Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Good afternoon, everyone. It's Susan Coffin at Attitude Magazine. Today we're very pleased to have Dr. Ross Greene with us. He is the author of a book that has saved many a parent from their own meltdown called The Explosive Child. Also the author of Lost at School, and he's the originator of a model of care that really focuses on collaborating with your child to resolve your child's behavioral challenges. He is a clinical professor at the Department of Psychiatry at the Harvard Medical School and is the founder of a nonprofit called Lives in the Balance, and I refer you to his website, livesinthebalance.org, for interesting information. Thanks so much, and Dr. Greene, let me turn it over to you, and thank you for doing this. I'm really very grateful to you for your time.
Thanks to you for doing this, and thanks to Attitude for sponsoring it. I'm glad to be doing this and always happy to get this information out to people in any ways that we possibly can. So let me just briefly, many of your listeners are probably familiar with my work, but just in case. My model brings to the table some important components. Component number one, children's behavioral challenges are the result of lagging skills. Not lagging motivation, lagging skills. And those lenses have important implications for not only how we are viewing these kids, very big difference between viewing a child who is doing any of the things that oppositional kids do through lenses of lagging skills rather than any variety of the other lenses that we might view them through, has important implications for how we're thinking about them and responding to them. It also has important implications for how we go about trying to help them. Why are so many kids with ADHD simultaneously diagnosed with oppositional defiant disorder, or ODD? Well, the core features of ADHD often compromise kids' skills in these realms in which kids with ODD are having difficulty as well: flexibility, adaptability, frustration tolerance, problem solving. Those are the skills kids with oppositional defiant disorder are lacking, and those are also skills many kids with ADHD are also lacking. So if some of our listeners have been wondering, well, how come those two so often go together? There's one man's answer to that question. ADHD brings to the table skills that can cause kids, can make it more difficult for kids to be flexible and adaptable, tolerate frustration and deal with it, and solve problems. Very important lenses. Here's piece number two. The lenses are the first part. What we do now that we have those lenses on is the next part. So often what we adults do when we are dealing with a kid who isn't doing what he's told, having a lot of temper outbursts, defying our rules and requests, as is sometimes called, we often try to teach them who's boss. We often use power and control strategies. And if we think that the reason the child is acting in these ways is due to poor motivation, well then, logically, what we would do next is try to use motivational strategies to change their behavior. And because parents are often viewed as culpable for their child's behavior, the reward and punishment strategies that we often apply are also intended to change parents' behavior. And my bet is that almost all of the people who are listening to this webinar are familiar with the reward and punishment approach. It's where we are rewarding good behavior, behaviors that we want to see more of, punishing behaviors that we want to see less of. That's done informally in many instances, but when it becomes formal, it takes the form of a sticker chart, point program, with the punishment being some form of timeout or loss of privilege, and a reward being able to cash in your stickers or your points for some goodie or being able to get privileges. And so the question often comes up, especially in the people who I work with, how come these strategies aren't working very well? The answer, succinctly, is because those strategies are oriented toward improving motivation. And poor motivation is not why kids exhibit challenging behavior. So if you're applying motivational strategies to something that isn't motivational in nature, there's really no reason to expect that it would work. So of course that raises a very important question. What should we be doing instead if this is about lagging skills, not lagging motivation? What should we be doing instead? Well, the first thing we should be doing is figuring out what skills the child is lacking. And here I want to refer people to the website of my nonprofit that you already mentioned, www.livesinthebalance.org. Or if people just Google me, Lives in the Balance will be the first thing that pops up. And I'd like to have people go, after this webinar, to the table of contents on the left side of the homepage and go to the resources section and a section called the paperwork and find an instrument called the Assessment of Lagging Skills and Unsolved Problems. That instrument has listed on it 20 or so skills that I frequently see lacking in behaviorally challenging kids. And job number one is to figure out what skills one's child is lacking. If my daughter has a fever, I want to know why. If my son is complaining of leg pain, I want to know why. I want to know what's causing it. And if you have a behaviorally challenging child, you want to know what skills your child is lacking so that you can know what's getting in your child's way. Now, the second thing you want to do with that instrument is identify the specific conditions in which the skills your child is lacking are causing difficulty for your child. And in the abstract, those lagging skills would be causing difficulty, especially in the conditions in which the lagging skills are being demanded by the environment. That's it in the abstract. But we're going to want to be more specific about that. We want to identify these specific problems. I call them unsolved problems that are being caused by those lagging skills and demands for those skills. And that, to be more specific, some fairly standard unsolved problems that seem to come into play with a lot of kids who exhibit challenging behavior in response to these unsolved problems. And by the way, the reason I call them unsolved problems is because if they were solved, they wouldn't be setting in motion challenging behavior. The fact that they are setting in motion challenging behavior tells us that they are unsolved. And what I find is that many challenging kids have a rather impressive pile of unsolved problems that have accumulated over time. Problems that are setting in motion challenging episodes very reliably. Every hour, every day, every week, we want to identify unsolved problems as well. Here's some examples. Difficulty brushing teeth at night. Difficulty completing the paragraphs in the English homework. Difficulty completing the double-digit division problems in math. Difficulty getting ready for school in the morning. Difficulty getting along with Charlie on the school bus on the way to school. Difficulty coming in from playing outside when called for dinner. Difficulty ending the video game to go to bed at 9 p.m. Notice they all start with the word difficulty. And then what comes after the word difficulty is whatever expectation it is that the child is having difficulty meeting. That's the unsolved problem. And so there are some examples provided on the assessment of lagging skills and unsolved problems. So we've now accomplished, by people taking the time to identify their child's lagging skills and unsolved problems, we've accomplished something very important. First, now we know what we're working. First of all, we now have the right lenses on. We know what skills the child is lacking. But we also know what problems we need to solve with the child so as to reduce the likelihood of challenging behavior in response to those problems. And now we only really have one other thing to cover. How do we want to go about solving those problems? You've got a few options. First of all, and I call those options Plan A, Plan B, and Plan C. Plan C is an important plan. That's the plan that we're using for some of the unsolved problems, the ones we don't want to be working on right now. Because the pile of unsolved problems is so big, and because we're not going to be able to work on them all at once, we're going to have to table some of them for now. Those are the ones we're using Plan C on. That's not giving in. That's just saying we need to prioritize here, because one of the biggest reasons the unsolved problems of behaviorally challenging kids remain unsolved is because we adults are still going about trying to solve them all at once. That's Plan C now. We're not going to solve a bunch of them in the beginning. We're going to prioritize. All right, now just two other options. With Plan A, you're solving the problem unilaterally, typically through imposition of adult will. And that's something that we adults tend to be famous for. The problem, of course, is that when we are solving problems through imposition of adult will unilaterally, well, unilateral problem solving often sets in motion challenging episodes in challenging kids. Now, why might that be? Because none of us actually love having will imposed upon us. Those of us who have the skills to deal with having will imposed upon us don't get too upset about it when it happens. But behaviorally challenging kids, the skills they're lacking, are also making it difficult for them to respond to having will imposed upon them. And that's why it's so reliable that if you rewind the tape on the vast majority of challenging episodes and challenging kids, what you'll find is an adult using Plan A, an adult trying to solve a problem unilaterally through imposition of adult will. And that, by the way, is also where adult-imposed consequences often come in. Here's what I've been saying lately. This is sort of fascinating. When we adults discover that the solution that we have come up with for the problem isn't solving the problem, we often kick in with adult-imposed consequences so as to give the kid the incentive to do the solution that already clearly isn't working. What we need is a different plan. And what I spend most of my waking hours teaching people to do is Plan B. And I also spend most of my waking hours teaching people that they don't need Plan A anywhere nearly as much as they think they do. Plan B is where you're solving the problem collaboratively instead. Any problem that can be solved with Plan A can also be solved with Plan B. And here's the best part. Because we've already used the assessment of lagging skills and unsolved problems to identify the child's unsolved problems, those unsolved problems are now highly predictable, and we can solve them proactively. So what I spend most of my waking hours teaching people how to do is solve problems collaboratively and proactively. Those are the two components of the model. Now, I should spend one more minute, and then we can go straight to questions, talking about Plan B, because there are 3 steps for doing Plan B, probably familiar to many of the people who are listening in here. Step number 1, it's called the empathy step, but the main ingredient is information gathering and understanding. Gathering information about and understanding what? The child's concern or perspective on the unsolved problem we're talking with him about, him or her about, proactively right now. Kids have info we badly need. Info that we need to understand what's getting in the kid's way, info that we need to understand the kid's concern or perspective on this unsolved problem. If we don't get that info from the kid, then we adults are at risk for doing what we so often do, imposing solutions that are uninformed. The empathy step is crucial. The define the problem step is next. This is where the adult is getting their concern or perspective entered into consideration. Adults have important concerns as well. The exact same concerns that could lead adult into Plan A could also lead an adult into Plan B. Same concern, different approach to getting it addressed. Same problem, different approach to getting it solved. And then finally, the third step is the invitation. This is where child and adult are brainstorming solutions, collaborating on solutions, but solutions that meet two criteria. Criteria number one, the solution has to be realistic, meaning both parties can actually do what they're agreeing to do. And criteria number two, the solution has to be mutually satisfactory, meaning that it truly and logically addresses the concerns of both parties, concerns that people put a lot of hard work into getting entered into consideration in those first two steps of Plan B. There's the rough summary of the model. Let's take some questions.
Okay, maybe one way to go about this would be to tell you a very, a question that was posted probably 10 times in different forms, and I think it's sort of a quintessential question. And here's an example. I have a 6-year-old boy with ADHD who's great when he gets to do what he wants to do when he wants to do it. However, when I ask him to do something like a chore or picking up something, he says no and then escalates into calling me stupid, idiotic. And when reprimanded, he says, I don't care. He won't go into timeout. He's too big to carry out. Losing privileges makes no difference. I can't allow him to be disrespectful to me, but how do I handle this? He often, this is something that many people mention, often apologizes later for his own behavior when he calms down. But it's not a solution to coping with it at the time that it happens. So there are probably 10 people who've written literally those exact words, different age children, different descriptions, but essentially child is fine until asked to do something that he or she just doesn't want to do and then goes into a rage.
Well, and you're right. That is the quintessential question. Let's establish something very important right up front, though. We all want to do what we want to do. And we don't want to do what we don't want to do. But that's not just true of behaviorally challenging kids. It's true of everybody. So now comes the big question. If we're walking at doing something that we don't want to do, we're not just going along with the plan. There's two different paths the adult can go down. And the first is the path that you're describing in this question. And that is for the adult to insist that the child do what you want him to do. And then when the child walks even further, to threaten or to administer punishment, which often now elicits the child's worst behavior, with disrespect being certainly on that spectrum, but sometimes, quite frankly, at the mild end of that spectrum compared to what some kids do under these identical circumstances.
Right.
And then we adults then do what we often were trained to do. We try to get the kid to go into timeout, or we, take away a privilege, sometimes escalating things even further still. And then when the smoke clears, the child is sorry they did what he did, and quite frankly, that's true too. The child is not happy that, and I'm going to put this into my own words, the child is not happy that people haven't yet figured out what skills he's lacking and haven't yet inquired with him, and this would be a much more collaborative and proactive approach, what's getting in his way on the different chores that he seems to be struggling to do, and what are the adults' concerns about why they feel it's important to do those concerns. That would be to define the problem step. And now, how can we work together to come up with a solution so that we're not fighting about chores anymore? And that's a completely different path to go down. It's completely different than in the heat of the moment, insisting, reprimanding, punishing, and having everybody pay the price for that. Now, here's the interesting thing. No, it's true. You can't let your child be disrespectful. So we have to remember that disrespect is usually, not always, but almost always, the aftermath of the scenario that I just described. And I find that when we are solving problems collaboratively and proactively, we don't see disrespect anymore because the problems have been solved in a way that's realistic and that works for both parties.
Could you describe a bit about, in that scenario, how a parent would work collaboratively with their child to address, let's take the examples that are frequently given here, unpleasant chores, whether those be brushing teeth or putting away clothes,
Well, the timing here is crucial.
Okay.
You don't want to be dealing with this in the heat of the moment, and that's where people end up dealing with it 95% of the time. We wait until this highly predictable, unsolved problem pops up again before we try to deal with it. And dealing with it in the heat of the moment adds two undesirable ingredients. Heat, as in heat of the moment, at which point most people, challenging kids included, and their caregivers included, aren't thinking very clearly. And rush. These things often pop up when we want to get some other stuff done, when we're on our way to someplace else. So the timing of doing this emergently is all off. Quite frankly, I would recommend that people, if chores is an unsolved problem, the first thing people have to decide is whether they want to deal with it with Plan C or Plan B. In other words, is this one of their top priorities at the moment? If not, they're not going to be talking to the kid about chores for the time being until they fry some of their bigger fish and try to solve some of their higher priority unsolved problems. So that's task number one. Let's identify these unsolved problems ahead of time so we can proactively decide how we want to handle them, C or B. If this is B, then we want to find a time to have a proactive discussion with the child so that this problem can be solved collaboratively and proactively.
Can you give a sample conversation? I think people would really find that useful.
Absolutely. The empathy step usually begins with the words, "I've noticed that." Billy, I've noticed that you're having difficulty taking the garbage out before the trash people come on Tuesday mornings. And then this introduction to the empathy step always ends with the words, "What's up?" What's up?
What's up? Yep.
Now, there's a few different things that can happen when we say what's up. In fact, I've identified the 6 most likely things that happen after we say what's up. Possibility number 1, he says something. Possibility number 2, he says nothing. Possibility number 3, he says, I don't know. Possibility number 4, he says, I don't have a problem with that. Possibility number 5, he says, I don't want to talk about it right now. Possibility number 6, he gets defensive and says something like, I don't have to talk to you. Now, the one that we hope happens is that he actually says something. And unless we have time on this webinar, I'll refer people to the Lives in the Balance website for how they should respond to the other 5. But if the child says something, the first thing the child says isn't going to give us a clear enough sense of what's really getting in the way, which means we're going to probably have to, in all likelihood, we'll have to probe for more information. And that's a process I call drilling for information. And drilling is, without question, the hardest part of doing all of Plan B. People get stuck there, but there's lots of great information about drilling, including some strategies that people can use to drill on the Lives in the Balance website, especially in the radio program's listening library. So there's lots of shows that are specifically describing and helping people drill well. But let's say the child says, it's too dark. That's his first response. The adult tendency is to then think they know what the kid means and to move on, but we're not going to do that. We're going to use a drilling strategy, and the most common drilling strategy, but by no means the only one, is just reflective listening, saying back to the kid whatever the child just said to you. It's too dark. And then often adding a clarifying statement like, how so? It's too dark outside when I'm supposed to take the trash out on Tuesday mornings. It's too dark outside when you're trying to take the trash out on Tuesday mornings. Help me understand how that's a problem for you. I'm scared. You're scared. Say more. I'm scared to be outside in the dark without one of you there. Oh, so taking the trash out on Tuesday morning when it's still dark, the dark is scary for you. Is that what you're trying to say? Yes. And that's why you don't do it? Right. And then you get all mad that I don't do it, and you yell at me. But it's all that yelling, and a kid probably isn't going to say that I'm just doing this to drive the point home. All that yelling isn't helping me with the fact that it's dark out and I'm scared. Now, the adult might be thinking many things at this point. The adult might be thinking, geez, I thought it was just because he was lazy. Or, geez, I thought it was just because he hates taking the trash out. We adults are frequently wrong in our assumptions about what's getting in the kid's way, and that's why the empathy step is so important. Now, the empathy step can go on well beyond that, but I'm gonna end the empathy step right there. I would ask for more, and when the kid has no more to give, that's when the empathy step is truly done. But in the interest of time, let's move on to the define the problem step. This is where the adult is getting their concern onto the table, usually beginning with the words, my concern is, or the thing is. That's what that would sound like. My concern is that if you don't put the trash out, then there's no trash there for the trash people to take, and then the trash piles up, and we get rats and mice and other rodents, and that's not very sanitary for any of us. The adult's concern is now on the table. The very same concern that might have led the adult to, say, give the kid a sticker every time he takes the trash out when he's supposed to, is now going to be addressed through an entirely different process. The concern is still going to get addressed. That's the important thing for people to understand. A lot of people look at this model and they're so worried about giving in that somehow, some way, they view this model as a form of giving in, and this model is not a form of giving in. There's actually no giving in this model. Let's move on. The adult concern is now on the table. Let's brainstorm solutions. So I wonder if there's a way, that's how the invitation usually begins. I wonder if there's a way for us to do something about you being scared of the dark when you're supposed to take out the trash. That's the kid's concern getting back on the table. But still make sure that there's trash there for the trash man to take so the trash doesn't pile up and we don't get rodents and it's not all unsanitary. That's the adult's concern. Once again, being entered into consideration. And then we're going to give the child the first crack at the solution. You got any ideas? Now, maybe he does and maybe he doesn't. It's not his responsibility to come up with a solution. It's just a strategy. Let them know beyond a shadow of a doubt that we're actually interested in his ideas, but this is a team effort. So if the child doesn't have any solutions, we hope the adult does. And what kind of solution are we trying to come up with? A solution that will address the child's concern about being scared of the dark, but still make sure that there's trash there for the trash guys to get so that it doesn't pile up, so that they don't get rodents. Now, what would a potential solution be? Possibly. And I'm not one for telling people what the solutions are. I just know what the criteria are. It has to be realistic. It has to be mutually satisfactory. One potential solution, this came up recently in my work, is that the child would take the trash out in the afternoon the day before, and that's when the adult would be reminding him to do it. And last I heard, that solution was still working. Solutions don't work. Solutions we adults come up with don't work if they are uninformed solutions. If we don't know what's getting in the kid's way, it is impossible to come up with a solution that will address it.
So there are a large number of people here who say that their child won't articulate why they won't do it, won't talk, will just melt down, become quiet, if not very aggressive, one or the other. Where do they start? It sounds like the key to the technique, which makes enormous sense, is to prompt the child to articulate the cause for the behavior. But there are many cases, at least among those who've written in, where the behavior is pretty broad. Again, it involves all kinds of different activities, and there's a very difficult time getting the child to speak. And I guess I don't know if this is the same question or not, but people are also writing in to say, well, it sounds like much of this work has to go on before the heat of the moment, which makes enormous sense. So what then should they do in the heat of the moment? You know, these are two separate issues, I guess.
Those are two different questions.
Right.
Let me, the easy one to answer, or actually neither of them is, let's answer one of them first. What should you do in the heat of the moment? defuse, de-escalate, keep everybody safe, and then figure out what set that unsolved problem in motion in the first place so that you can solve it proactively and not in the heat of the moment. That's what you do in the heat of the moment. Nobody has incredible advice for what to do in the heat of the moment because there's nothing to do in the heat of the moment. So that's usually a fairly quick one to answer. People dealing with unsolved problems in the heat of the moment are frequently those who haven't yet filled out the assessment of lagging skills and unsolved problems yet. And so they don't have their list of unsolved problems yet. And therefore, the problems that are setting in motion challenging behavior are still feeling surprising and unpredictable to them. That's why I always say it all begins, the journey begins with the assessment of lagging skills and unsolved problems. It is crucial to identify lagging skills and unsolved problems ahead of time. Otherwise, we're stuck in the heat of the moment. One of the any unsolved problem we've written in on the assessment of lagging skills and unsolved problems is by definition predictable. Otherwise, we wouldn't have been able to write it in. So now we kind of have to reorganize our lives a little bit, and quite frankly, the explosions or the challenging behavior take way more time than proactive Plan B is going to. But proactive Plan B is going to work a whole lot better than emergency Plan B. So, quite frankly, this is one of the ways in which I and other clinicians who are using this model help families sort of reorganize things a little bit so that they are approaching problems in a much more proactive way. That's the answer to heat of the moment. What do we do about kids who won't talk? Well, in your wording of that question, you are referring to behavior. We are talking to the child about his behavior. The behavior is not the unsolved problem. This is a huge point. We're not talking to the child about hitting. We're not talking to the child about screaming or swearing. These are the things the child does in response to unsolved problems, but aren't the unsolved problem. The unsolved problem is difficulty taking the trash out on Tuesday mornings so the trash man can get the trash. That's the unsolved problem.
Or getting up in the morning for school, getting dressed on time, et cetera.
Those are the unsolved problems.
Right.
What the child does when the adult is insisting that the child do what the adult is insisting to do, the child do, that's behavior. But that's not the unsolved problem. So this is where it's this is sort of the divide in the road in terms of what are we focused on with the child? His behavior or the problems setting in motion the behavior? Now, if you ask a kid about his behavior, even if you're doing it proactively, number one, a lot of kids won't talk to you because they feel like they're in trouble again. Number two, they're defensive. Now they're being called on the carpet for their behavior yet again. And number three, we're really not asking them about anything because if this child is a hitter, then he hits when he's being asked to take the trash out, and he hits when he's being asked to do his homework, and he hits when he's being asked to go to bed at night, and he's hit when he's being told to get off the video game. Hitting a behavior cuts across many unsolved problems, and each of those unsolved problems need to be solved. But here's the interesting thing. Once again, this is the divide in the road. What we do is we'll put this kid on what we often do, and this is not what I recommend. We put the kid on a sticker chart for each time he doesn't hit. He loses a sticker if he hits. He gets a sticker if he doesn't. He gets enough sticker, he gets a goodie. All of that is entirely focused on behavior. And yet, even if he stops hitting, unlikely, by the way, many people have had that experience, the problems that were giving rise to the hitting are still unsolved, and we still know nothing about them. Because all we've really done is put the child on a sticker chart for hitting. Here's the good news. If you solve the trash problem, if that problem gets solved collaboratively and proactively, not only is the problem going to get solved, the hitting that goes along with the problem is going to subside because now the problem that was giving rise to the hitting has been solved. Completely different mentality, completely different focus. So many of us were trained to focus on behavior In this model, you're focused on the problems that are giving rise to that behavior. A radical shift in what we're focused on and what we're trying to accomplish.
Very interesting. There are a number of parents who are very concerned about violence. So here's one. My 7-year-old son is very violent toward me during all of his rages and so forth. So in those cases, can you give some examples of how the parent would get at the underlying causes and there are similar questions relating to violence and aggression toward siblings or toward another parent?
Well, first of all, what violence usually refers to is a more severe form of looking bad. So this is a child who isn't just screaming, swearing, not that those are so pleasant.
Right.
This is a child who is destroying property, physically aggressing toward people. There's verbal violence as well. And none of that is, all of that is extremely difficult to live with. But what that mostly speaks to, as hard as it can be to live with, is the severity of the child's response to the unsolved problem and to the environment's response to the child having difficulty with the unsolved problem. So this is not meant to diminish how awful it is to live with a child who is being violent toward a parent or a sibling or a teacher. But it is basically saying that what we're talking about here is the severity of the child's response. And severity doesn't necessarily alter the approach. Once again, we don't want to be primarily dealing with a severe response to an unsolved problem. We're calling it violence, but I'll call it severe in the heat of the moment because it's already happening. And now we're very wrapped up in what are we going to do now that this child is completely out of control and hurting people. Horrible timing. That timing is what gets a lot of kids, what gets adults to lay hands on a lot of kids in the form of a restraint or a seclusion or physically holding a child in timeout. And to tell you the truth, we don't want to be doing that. Those are last resorts. Unfortunately, those are often acts of desperation. But if we're identifying the problems that are giving rise to the severe response ahead of time, and we are prioritizing, and there's a bunch that we're not working on right now. The child is not going to respond violently. The problems we are not working on right now. And if we use Plan B to come up with proactive and collaborative solutions to those problems that we are working on, we are going to see a rapid, dramatic reduction in violent behavior. Now, are there some kids, and I should probably mention this at this point, are there some kids who get out of control so quickly and are so revved up so much of the time or so irritable so much of the time that before they can participate in this process, they need medical intervention to muffle their emotions or reduce their activity level or enhance their mood? Yes, that happens. And there are medications that can sometimes be helpful along those lines. But I must say, in the vast majority of instances, I'm finding that Plan C, the things we're not bringing up right now, and solving problems with Plan B can be an extremely effective way to reduce violence if we're going through the steps that I've been describing during this program.
Some questions that are fine-tuning within this framework. Here's someone, Wendy, who says one of the most frustrating things for us is that even after having had a successful collaboration with my child about an unresolved problem, let's take example, the trash problem, only a few weeks later my child finds a new reason not to take out the trash. Does this mean that there's yet another unresolved problem that he didn't share the first time, or is something else going on? So there's the...
Well, my first take at that is that, number one, it's not uncommon for the first solution to not solve the problem durably. And that's what she's describing. The first solution didn't solve the problem durably. Right. Now, why do I not feel bad about that? Because in real life, the first solution seldom solves the problem durably, not just in the context of this model. In real life, the first solution seldom solves the problem durably. In real life, good solutions, durable ones, come from what we've learned from the solutions that preceded them that didn't quite work so well. So now the question becomes, how come the solution didn't stand the test of time? And I can think of three reasons, one of which Wendy, who asked the question, has already actually mentioned. But I'm going to mention that one third. Here's possibility number one. The solution wasn't as realistic as we thought it was. We thought it was. It wasn't. That should come out in the Plan B wash, as I say. Possibility number two. The solution wasn't as mutually satisfactory as we thought it was. We thought it was. We thought it addressed the concerns of both parties, but there are concerns that the solution didn't address as well as we thought it did. And now possibility number three, and this is the one that Wendy kind of hinted at. We've only done Plan B on this unsolved problem once, and we got as many of the concerns of the child and many of the concerns of the adults entered into consideration in our one Plan B discussion, and therefore our solution addressed only the concerns that we heard about. But the solution wouldn't address the concerns that we didn't hear about. Back to Plan B to figure out what those concerns are and see if we missed something, or at the very least, to inquire about why the solution that seemed to be working for a while isn't working now. Going straight back to the empathy step to find out what's going on.
I think some parents are posting, are we not being manipulated? I mean, that's, I think, the concern. Are these behaviors manipulative to avoid doing the task? And a couple of posts to that about being manipulated.
Well, nobody loves being manipulated. And everybody's worried about being manipulated. The whole manipulation idea comes from the belief that the child's challenging behavior is an effective means of coercing adults into capitulating to the child's wishes.
Right.
That's not this model. That's a different way of thinking. When you're solving problems collaboratively, you're a team. This is not adversarial. This is not enemies. This is teamwork. The child and the adult are collaborative, are problem-solving partners, is what we might call it. And there's really no reason for the child to manipulate when this is not adversarial, and when this is not enemies, and when this is a problem-solving partnership. But the reality is I don't think kids are being manipulative anywhere nearly as often as they are accused of being manipulative. Right. That comes from a completely different way of thinking that I do not subscribe to.
There's a couple of posts here from parents who are trying, I think, quite collaboratively to work with their child and are being constantly lied to. For example, quote from Catherine, "My child consistently lies about tasks that we've collaboratively come up with a solution for. For example, we decided that he will brush his teeth in the morning with only 2 reminders. He consistently lies and says he's done the task." He's 13 years old, by the way. It sounds like this is a behavior, and we try to reinforce it, but it's very challenging. He says he lies to avoid punishment, but we've had many conversations about the fact that he won't be punished if he doesn't brush his teeth. He'll just have to brush his teeth. So there's an example. And there's another person who says, what about, compulsive lying? It's hard to tell what the true issue is. My son constantly changes his answer 3 or 4 times, tells me one thing and the teacher another. So any thoughts on that sorts of behavior?
Well,
what's underlying that? Or
the one that's the most specific is the teeth brushing one.
Yes.
And given the lenses that I wear, what I'm hearing in what was described by the question is a solution that isn't mutually satisfactory yet.
Right.
And what I'm hearing is there must be something that is still keeping the child from brushing his teeth. And telling the child that not to lie about it because he's not going to get in trouble. He's just going to have to brush his teeth, is a good example of what we adults sometimes say, but that actually still wouldn't solve the teeth brushing problem.
Mm-hmm.
In other words, if in the parlance of this model, what we're saying is, don't lie about not brushing your teeth. We're just going to do plan A when you don't brush them.
We're going to make you brush them, right?
Correct. So that all that says to me, and I have a different filter on here. I hear in that description a solution that isn't mutually satisfactory, and what I'm really hearing is the distinct possibility that the concerns of the child still aren't well understood yet, and or that the solution that they have come up with isn't getting the job done. Simply insisting that the child brush his teeth isn't going to solve that problem.
Okay.
And the other time I hear lying come up, I should add, sometimes people say that a kid is lying when they are talking with a child about one specific incident, and there are eyewitness accounts, and it gets into a he said, she said, or here's what I saw, no, that's not what happened. But we really don't want to get into he said, she said, or here's what the eyewitnesses saw, because those are usually only about one event. So let me give you an example that comes to mind. I saw you hit Billy on the playground when you guys were disagreeing about the box ball game. I didn't hit him. I saw you hit him. I didn't hit him. I saw you hit him. Okay, this is going nowhere, right? But hitting is the behavior. And what we're into now is sort of a what resembles much more closely a police interrogation, not plan B. The unsolved problem, if this is a one-timer, then it's a one-timer. But the likelihood is that this is not a one-timer. We want to be talking with the child about the disagreements he's having with Billy during box ball on the playground. And if we're talking with him about that, then what happened during the disagreement that occurred at 2:15 p.m. on Tuesday actually doesn't matter so much anymore. Number one, that's a one-time incident, and number two, we'd rather be talking with a child about an unsolved problem rather than his challenging behavior. But number two, if that problem gets solved, we're not going to have to talk with him about hitting anymore anyways, and now the eyewitness accounts don't matter. The problem is solved. There's not going to be any hitting in response to that unsolved problem anymore. And, well, that's often when adults are telling me that a child is lying. That may not be exactly what the person who wrote the question was referring to, but that's the most common scenario in which I hear people telling me that the child is lying. The eyewitness accounts differ. The child is lying. Here's what I've found about lying. Some people may not love hearing this. I always find that there's, behind every so-called lie, there's a kernel of truth.
Interesting. Yeah. There's something in there that's going on.
Correct. What else we got?
Here's a person who says, what if the problem is just not realistic? Like the problem, I'm not sure this is a problem, but the problem is that they want to play video games and Legos all day long, and they don't want to stop. How do you get a transition without an aggressive meltdown?
I would have to reword that unsolved problem. It's what the child is supposed to be doing instead of playing video games and Legos all day long.
Right, the behavior is the video games, and the problem is something else.
I don't know what the problem is. If the problem is going to school, that's the unsolved problem. I've noticed that you're having difficulty going to school. What's up? If the problem is hanging out with friends on the weekend, I'm not exactly sure when this unsolved problem is happening. If the unsolved problem is hanging out with friends or going to do an activity, I've noticed that you don't seem to want to play with your friends during the weekend. What's up? I've noticed that you don't want to go out for any teams. What's up? I've noticed that when we want to go out and do something like go to the park on the weekends, you aren't too enthusiastic about that. What's up? So I would reword it so that I could not be talking with the child about what he is doing, the behavior, but rather the expectation he's having difficulty meeting.
Okay. That's good. There's a comment from someone here that also raises another question. She's first saying how much help she got from reading The Explosive Child, and that she wanted to add that her daughter has had a very difficult time explaining the problems she was having, and she had to figure them out. And once she did, her behavior changed. But the key in this person's case was having her learning disabilities diagnosed. Once she determined that she had undiagnosed learning disabilities, it became much easier for them to understand the problems that she could not verbalize. And that raises the question for me of a number of people have posted asking, how do they distinguish oppositional defiant disorder from a whole variety of things, bipolar disease, sensory integration disorder, lots of other things going on, learning disabilities. Do you have thoughts on parsing apart those different disabilities and behaviors?
Well, this speaks to why I'm not a very diagnostically oriented mental health professional. Oppositional defiant disorder is a list of behaviors that we don't like, that it has been determined tend to clump together. The same can be said about virtually all childhood psychiatric diagnoses. If you look at the criteria for the diagnosis, it is a list of behaviors that are what we would call developmentally deviant. In other words, not behaviors that we would expect for a child of the same age and developmental level. But if that's what a diagnosis is, a list of behaviors, then it gets very confusing when we're trying to decide whether the child has this disorder or that disorder, because what we're really saying then is the child exhibiting these behaviors or those behaviors, because it's behaviors that comprise psychiatric diagnoses in children. And it doesn't take me long to talk with adults and get a pretty clear picture about the challenging behaviors the child is exhibiting. But rather than, and this is another important fork in the road, rather than thinking now, how do those behaviors clump together? We've already established during this program that behavior is not the most important part. There are behaviors that kids exhibit when they are under duress and having difficulty solving a problem that are more mild. And there are behaviors that kids exhibit under those circumstances that are more extreme. Those are behaviors. Where I'm going is, I'm going straight for, okay, I know what the behaviors are. I'm not thinking, now what psychiatric diagnosis best summarizes those behaviors? What I'm thinking instead is, what unsolved problems can I learn as much about as possible that are giving rise to those behaviors? That's where I'm going. And that requires not asking the question, so what did he do? What does he do? What behaviors is he exhibiting? But rather, tell me about what was going on when those behaviors were being exhibited. What was the disagreement about? What was he balking at doing? What were you insisting that he do that he didn't want to do? Because those questions are the ones that are going to give us the information we need about what the child's unsolved problems are. If we are focused on behavior and diagnosis, then we still, and this is, boy, I cannot say, I'm glad we're covering this because this is so important. When we focus on behavior, we focus on modifying it. When we focus on diagnosis, it makes it sound like the problem resides entirely within the child, and it's the child who needs to be fixed. When we focus on the problems that are giving rise to those behaviors, and when we recognize that it is those behaviors, when they clump together, that comprise psychiatric diagnoses, when we're focused on problems, we can focus on solving problems. But we have to get the information to that level of analysis to begin focusing on problems rather than behaviors and diagnoses. And boy, is that crucial.
So it really is about going back to the beginning and saying what circumstances brought about this behavior, not how do I fix this behavior, or what psychiatric disorders causing this behavior.
That's correct.
What circumstances cause this behavior?
In other words, saying that a child is hyperactive, impulsive, and inattentive because he has ADHD is basically repeating ourselves. If I could just as easily say, he has ADHD because he's hyperactive, impulsive, and inattentive. We need to get to the level of lagging skill, and that was the beginning of the question, by the way, how much the person who wrote the question learned about the child. But the earth-shattering moment was when they realized what skills their child was lacking, not what the behaviors were, and not what the diagnosis was.
Interesting. Okay. Just to turn for a second, we're sort of almost out of time, unfortunately, to school. There are a number of folks who, there are number of folks whose children refuse to go to school, stop performing in school, seem depressed, angry, even a child whose the love of his life is baseball, and because of his performance in school, he's no longer able to play on the baseball team, but still refuses to go to school, study for exams, and so forth. Number of people whose children are really school resistant. Any thoughts on how to tackle? I guess I'm going to answer the question. What's going on here? Yeah.
Well, by this point in the webinar, the answer is probably crystal clear. There are unsolved problems at school that we may not know about yet. Even if we know about them, they haven't been solved yet. Even if we've tried to solve them, they haven't been solved in a way that's actually working. And we can punish the kid till the cows come home. We can take away everything. The problem just doesn't be there. And until we solve them collaboratively and proactively, the behaviors are going to remain.
Okay. Yep, makes sense. A couple of people say that they've put in place your techniques and they've had tremendous success on the home front, but it's not what's going on at school. The school environment is punitive and sort of much more focused on punishments, and their children are having tremendous difficulty at school, even though they've seen success in turning around their behavior on the home front. And they're asking, what do they do? How do they transmit some of these techniques in the school environment?
They find somebody, and they're absolutely right. I mean, one of my biggest missions in life these days is to transform school discipline programs from the punitive, adversarial, unilateral to collaborating and helping kids and adults become teammates on solving problems. That occupies a great deal of my thinking and my efforts these days. But I guess the key strategy is to find somebody in the building, guidance counselor, teacher, school psychologist, principal, assistant principal, somebody who is open to these ideas and willing to help the parent strategize about how to help these ideas find their way into the way adults understand and interact with their child. And unfortunately, that's a soundbite. There's a lot more information about that on the Lives in the Balance website in the listening library for parents as well.
Okay, that's great. Sounds like your website's a great resource. Thank you again. I think the perspective you bring is such a fresh one. Just makes us all stop and ask ourselves about our model of enforcing behavior and repression and sort of punishment as a way to control behavior. So thank you so much for all your time and all that you've done.
My pleasure. Happy to do it anytime.
Thank you so much. Bye-bye.
Take care.
For more Attitude Podcast and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.